We invite another speaker for the Hinohara Memorial Lecture, Dr. Rosalie Shaw, come to here. And Dr. Cynthia Go will introduce her about her. I pass the chair to the Cynthia Go, please.
Thank you very much, yes. I have the honor and pleasure to introduce our next Hinohara Memorial Lecturer, Dr. Rosalie Shaw, who is someone closely involved in the formation of the APHN and to whom we're greatly indebted. The APHN would not be the network that it is today had it not been for the early efforts of Dr. Shaw, who was our first executive director, dating from 1999, before the APHN was officially registered in 2001, and right till her retirement from APHN in 2009. Not that she was really retired, Rosalie continued to practice as a palliative care physician and mentor, doing full-time locums at several locations in Australia and even worked in New Zealand from 2009 until her recent ill health in 2021. As she mentions in her recorded lecture, she has been hospitalized these past 6 months after a fall when she fractured her hip. She's had 3 operations and has been on the receiving end of many pain medications. But hopefully she is finally on the mend and there are plans for discharge from hospital. Rosalie has had to record her lecture from her hospital bed. Dr. Shaw was trained first as a teacher, then as a nurse, then as a doctor, but last but not least, as a hospital administrator. In that last position, she established the first hospital-based palliative care unit in Australia at Hollywood Hospital in Perth. So she is one of the pioneers of hospice in Australia. I invited her to Singapore to build the first hospice home care service at the Hospice Care Association in 1992. And as she tells the story, she said she came for 1 year and stayed for 18 years, spending the last decade and more building the APHN from scratch. Dr. Shaw has received many honors, the Public Service Medal from the Australian government, and in 2011, the Order of Australia. She was also awarded national honors from the Singapore government in the form of the Public Service Medal. So please welcome Dr. Rosalie Shaw, APHN's first executive director and the teacher, mentor, and friend to many of us. Thank you.
It is a great honour for me to be asked to present the Hinohara Lecture at the 14th Asia Pacific Hospice Conference and the 20th anniversary of APHN. The APHC has always been a time when we came together as the APHN family, a time to rejoice in meeting together and sharing achievements and challenges. We were looking forward to meeting in Japan, but as COVID progressed, we were disappointed when it became obvious that this was to be a virtual conference. The Hinohara Lecture at each APHC honours Dr. Shigeaki Hinohara, our patron until his death in 2017. In this lecture, I would like to talk about Dr. Hinohara the person, about his values, and about his role in the establishment of APHN. I would then like to reflect on how APHN has continued to express these values in the past 20 years. Dr. Hinohara was an extraordinary man who was considered a national treasure in Japan, and in 2015 was given by the Emperor of Japan the Order of Cultural Merit, Japan's highest award. Dr. Hinohara was born in Yamaguchi Prefecture in 1911. His father was a Methodist pastor who had studied at Duke University in the United States. He had a strong influence on Dr. Hinohara, who was a devout Christian for the rest of his life. His decision to do medicine came after the family doctor saved his mother's life. He graduated in 1937 from the Kyoto Imperial University's College of Medicine. After spending a year at Emory University in Atlanta, he joined St. Luke's Hospital in 1941. He stayed with this hospital for the rest of his life and was still honorary president of the hospital at the time of his death. From 1941 until 1945, Tokyo was experiencing firebombing raids by the US Army Air Forces. During this time, more than 100,000 civilians died and more than 1 million were left homeless. St. Luke's Hospital, located in central Tokyo, had a key role in treating the victims of these raids. At the end of World War II, a US Army chief surgeon gave Dr. Hinohara a copy of a book by the famous Canadian physician, Dr. William Osler. Dr. Osler's views on clinical medicine and medical education greatly influenced Dr. Hinohara, who in 1981 translated and co-authored a book of 20 of Osler's lectures, and in 1983 founded the Japan Osler Society. However, it was an event in 1970 that greatly changed Dr. Hinohara. He was involved in a hijacking of a Japan Airlines plane en route from Tokyo to Fukuoka, when Dr. Hinohara was to attend a medical conference. A militant communist group took 129 crew and passengers hostage, threatened them with samurai swords and pipe bombs. They spent 4 days handcuffed to their seats in the plane on the tarmac in Fukuoka in 40-degree heat. After his release, Dr. Hinohara said that he felt privileged to live and decided to dedicate the rest of his life to other people. In 1945, when a group released sarin gas into the Tokyo underground, Dr. Hinohara was once again able to play a key role in saving many victims of this attack. As medical director of St. Luke's Hospital, in preparation for a mass disaster such as an earthquake, he had installed oxygen outlets along all the corridors, in the basement, in lounge rooms, and even in the chapel. St. Luke's Hospital received 640 patients from the sarin attack over a 2-hour period and was able to save all but one of these people because of the availability of oxygen throughout the hospital. I first met Dr. Hinohara in the late 1980s when he came to Perth, Western Australia on a medical tourist trip. He'd been interested in visiting hospices around the world and so welcomed the opportunity to visit the Palliative Care Unit at Hollywood Hospital and the Cottage Hospice, a standalone inpatient hospice. Both organisations had opened custom-designed buildings in 1987. Dr. Hinohara was so impressed by the design of the Cottage Hospice that he invited Dr. Ian Watson, the architect, to come to Japan to build a replica of the Cottage Hospice in Kanagawa, about 1 hour by train, southeast of Tokyo. The land was on a hill beside a golf course with a clear view of Mount Fuji. While plans were underway for the hospice, Miss Tatsuko Matsushima was sent to Perth in 1991 in preparation for her role as the Director of Nursing of the hospice. The Peace House Hospice opened in 1993. Dr. Hinohara was aware there were pockets of interest in many centres in Asia. Some were more developed than others. His vision was to provide an opportunity for these pioneers to meet and to share ideas and resources. From 1992, he began to invite and sponsor key persons to Japan each year. They were asked to give lectures at seminars. However, the primary intention was the sharing of information about programs in each country and for the development of a network of friendship across the region. It was discussions at these annual meetings, generously sponsored by Dr. Hinohara, that led to the decision to formalise this group. Hong Kong, Japan, Singapore and Taiwan agreed to fund the new organisation, which is to be registered with an office in Singapore. I was appointed as Executive Director in 1999. There was much discussion about the name of the organisation. Was it to be Asia Pacific Hospice Network or Asia Pacific Palliative Care Network? Some potential members already had hospices. Others were using the term palliative care. It was finally decided to incorporate both hospice and palliative care in the name Asia Pacific Hospice Palliative Care Network, but to use APHN as the abbreviated term. These were exciting days, writing a constitution, creating a membership database, setting up a website, and designing a logo that would represent the vision of APHN. The logo that was agreed to was a stalk of rice, the staple grain of the region. The grains were green rather than gold, the colour of vitality and growth. But in the future, the grains will ripen to become seed for new growth and development. The circle made by the bent stalk is broken, just as the lives of our patients have been broken by their terminal illness. I began to make visits to countries in the region. My first was to Taiwan in 1999. I lived for 1 month in the hospice at Mackay Memorial Hospital in Taipei. I spent each day teaching and mentoring at the bedside. This set the pattern of my role for the next 9 years, during which I made more than 124 visits to 22 countries as teacher and management consultant, always concentrating on bedside teaching. I developed wonderful relationships with amazing people who, despite lack of support, continue to provide services to patients in need. One of the greatest challenges for me was to ask, what is palliative care within each cultural setting? I became aware that the way of communicating in Western English-speaking countries was not appropriate in countries where talking openly about death was taboo, and where morphine, the cheapest and perhaps the safest analgesia, was so feared by doctors and patients. I needed to remind myself that palliative care was about the relief of suffering, physical, psychosocial, and spiritual suffering, the relief of what Cicely Saunders called total pain. This means using whatever is culturally acceptable and available. So often the discussions in the teaching sessions revolved around communication with patients and families. As one doctor in Vietnam asked me, please teach me how not to lie to my patients. Dr. Hinohara was a man with extraordinary energy. He always kept a 5-year diary, and he was still seeing patients until a few months before he died at 105 years of age. He attended all lectures at seminars he organised, and although he often appeared to be dozing in his chair, he would always make comments at the end of each lecture and provide a commentary at the end of the day. After a long day of lectures at the Peace House Hospice, Professor Amy Chow from Hong Kong and I were driving back to Tokyo with Dr. Hinohara. We were in the back seat and looking forward to being back at the hotel. Dr. Hinohara was in the front seat next to the driver with the overhead light on. He was writing a book. This was in 2002, and he was 93 years old. When we reached the hotel, Dr. Hinohara told us he was now going on to give a lecture at another venue. He was a very prolific writer, and after his 75th birthday, published more than 150 books. The most well-known of these was Living Long, Living Good, which sold over 1 million copies. Dr. Hinohara believes that writing was an important way of transmitting ideas. In 2015, when I last met him 2 years before he died, he told me that he was writing a book for children about the Japanese Constitution so that they would understand the importance of peace. However, we in palliative care have not followed his example. Few of us have written about our experience in palliative care as palliative care practitioners, nor have we written the narrative stories of our patients. When asked by palliative care trainees or medical students for a book that explains the essence of palliative care, I often find myself recommending Being Mortal by Atul Gawande, a surgeon. Dr. Hinohara had a lifelong interest in music, and if not for medicine, he may have chosen a career in medicine. It was he who introduced music therapy to Japan, and at the age of 88, wrote a script for a musical based on The Fall of Freddie the Leaf, a book by Leo Buscaglia. It was performed in Broadway in 2010. The APHN has been able to realise the dream of Dr Hinohara to create a network throughout the region. He has been responsible for building bridges, hospice, palliative care beyond borders, the appropriate theme of this conference. In total, 2,030 individual members from 42 regions and 260 organisational members from 18 regions have joined APHN. The biennial Asia-Pacific Hospice Conference has been an important way for the network to be maintained, and this, the 14th APHC, has nearly 900 virtual participants. It was in 1996 at the Hospice in Asia in Singapore that the decision was taken to hold a regional conference every 2 years. In 2001, the year APHN was registered, the APHC, in collaboration with APHN, was held in Taiwan. The next APHC in 2003 was held in Osaka, so this is the second time that Japan has hosted the conference. One of the APHN's most important projects was the collaboration with Flinders University from 2006 until 2013. During these years, 109 doctors, nurses, and allied health professionals from the region were able to complete the Flinders University Graduate Certificate in Health, Palliative Care. APHN sponsored students to come to Singapore twice a year for 2 weeks, intensive classroom teaching for 2 weeks intensive classroom teaching, followed by 4 weeks clinical attachment with a palliative care program. Many of the alumni have become leaders as teachers and advocates for palliative care in their own countries. In the past decade, APH has been concerned in aiding development of palliative care in specific countries, with teams travelling to Myanmar, Bangladesh, Sri Lanka, and India. As some of you are aware, after a fall following by 3 orthopedic operations with complications, I have been in hospital for the past 3 months. During this period, I've had time to reflect on the practice of medicine and of palliative care. Dr. Hinohara always emphasised the importance of treating the person, not the disease. I am concerned that focus is shifting from the person to treating the symptoms of the patient. When in pain, instead of being asked about the pain or offered a change of position, a hot pack or a gentle massage, the immediate response has often been to get the medication chart and to give the prescribed PRN medication with great efficiency. Rarely did staff linger at the bedside to explore my anxiety, nor return later to check if I was feeling better. I longed for physical touch, for a doctor to place a stethoscope on my chest. Physical examination was reassuring to me as a way of showing that the doctor was interested in me and not just relying on reports from the nurses. From what I have observed and have been told by my concerned colleagues, the failure to perform physical examination and the primary focus on pharmacology to manage symptoms is also found in palliative care. COVID has limited our contact with patients, and PPE has made communication more difficult. However, compassion is shown in those moments we spend at the bedside, when the focus is on the person, not on the pain score, when we take time to hear the patient's disappointment, fear, grief, and despair. A quiet expression of concern, even if muscled by a mask, and the compassionate gesture through a gloved hand can be more effective analgesia than another dose of endone. I'm also concerned that we may be so focused on prolonging life that we have forgotten that our patients sometimes long for death and would like to open up those difficult conversations that can give comfort and reassurance. Even Dr. Hinohara was able to refuse artificial feeding when he could no longer take solid food and asked to be discharged home, where he died some weeks later. We are very grateful to Dr. Shigeaki Hinohara for his generosity in making possible for this network to be established and for his ongoing patronage during his lifetime. Perhaps it is appropriate to end with his own words. It is my important mission to pass down this preciousness of life and of peace to future generations. Palliative care is not just about dying and suffering. It's about enabling our patients and families to live as fully as possible in those last months, weeks, and days, so that they too can experience the preciousness of life.
I think that is the end of Dr. Rosalie Shaw's lecture, which is a deeply personal lecture with her own messages for all of us. I think many of us have not heard her voice for some time, but so many of us hold her in our hearts. And I'm sure many of you, like me, are deeply touched to be able to see her, even if it is on video, even though we can't see her in person. Now, I don't think Dr. Shaw is present at this conference to take questions because I think she's still in hospital, and I'm not sure that she is able to be able to join us for Zoom. Could I ask the organizers whether you have heard from Dr. Shaw on this? No? Yes. So, but we do have some time, but I think we don't have any questions that I could see, because it's not the sort of lecture, is it, that that people ask questions to clarify facts and so on. Is there anything that people would like to share about Dr. Shaw and your experiences with her? Because we do have some minutes that we can spend together, and it would be very, very nice to hear about your memories of Dr. Shaw, and I'm sure it's very good for those of you who know her, and I think many, many people in this audience know her, that we know that she is okay. She may not be in the best of health, but she is improving. So that's a really good thing. Dr. Hayashi, do you have any comments on that lecture?
Yeah, it's a very honor to be able to be chair this lecture and this session. And we have many special relationship with speakers and chair. And Dr. Shigeaki Hinohara graduate Kyoto University, and Dr. Tatsuya Morita graduate Kyoto University. And I went to the Kyoto University once a week or once a month in 2 years or another when I was in Kyoto Prefecture. In those days, to going to the spread the palliative care in the university and general hospital to share the palliative care from the beginning of the diagnosis until the dying. Because I think that we don't have to wait at the hospice. We have to go out to the another region. That because and special thanks to the this committee to give me a chance to be a share this lecture. Thank you very much for your committee. Thank you.
And Dr. Hayashi, you have taken a place at St. Luke's Hospital, which is Dr. Hinohara's.
Yes.
I mean, I was, Dr. Shaw and I both stayed in the hotel next to the hospital, and we had our APHN meetings in the hospital. Yeah. But did you, I'm sure you know about the stories that Dr. Shaw mentioned in her lecture, about the sarin attack and the oxygen that is in the hospital. Would you like to tell us something about the legacy that Dr. Hinohara left after so many years?
Dr. Hinohara's legacy remains in our hospital. The tender loving care is a very important thing for our hospital staffs, like a philosophy of our hospice staff. She tells us about tender loving care many times until he died. He comes to our hospice ward once a month or 2 times a month until before 2 months before dying. That is very great thing for us. And he tells us the importance of the hope, to have a hope. And he gave hope for the people, especially in the patient and the families and the staff. He gave us hope with smile. That is a very good relationship. It's my honor to be here, to be a staff of St. Luke's Hospital. Thank you.
We've been receiving wishes of goodwill from the audience, and perhaps I should read out some of the messages so that to share with you all. We have Dr. Raymond Ng saying that it was such an inspiring talk that Dr. Shaw gave, and she has a special place in all our hearts, a special teacher, and we wish her all the best. Professor Gauri Agarwal has said that Rosalie is not able to join us today to take questions, but she sends her best wishes to all, and I hope that she's watching all this as well. Dr. Megan Pruti says it's always a pleasure to listen to leaders that give us strength to work harder towards development of palliative care, palliative medicine in India. And best regards from Dr. Mega Pruti. Professor Amy Chow says, I would like to salute these 2 giants in our palliative and hospice movement. This is Dr. Morita as well. They share a common mission to live fully every day to build a better world for others. And I hope we can all follow their examples. Dr. Rina Nga from Singapore says, thank you, Dr. Shaw. I particularly was reminded not to fall back into my old ways of treating numbers, now that we have pain scores, AKPS, etc., but to remember to treat the person. And Dr. Naomi Katz has said, sent the message, I would like to send my regards and love to Rosalie and the honor to hear her words. Rosalie spent time with us at the Royal Children's Hospital several years ago, filling in for Jenny Hinson, who was on sabbatical. There are so many messages and learnings that I hold close to my heart, including our Tuesdays with Rosalie sessions. So thank you, Rosalie, and wishing you well. And there is a comment from Dr. Devaraj. Thanks to Dr. Shaw once again for drawing attention to touch. Dr. Maria Wicaksono from Indonesia, from Jakarta, says, thank you, Dr. Rosalie Shaw, for your impressive lecture. We appreciate and treasure the history of Dr. Hinohara and his teaching. We wish you a speedy recovery. All the best. We love you. Dr. Seema Rao from Bangalore is saying, it's a pleasure to listen to Dr. Shaw, very inspired by their journeys. And I hope we will all be inspired by this. So thank you, everybody, for your comments. Perhaps I will let Dr. Hayashi close this session and thank everybody for attending.
Thank you.
Bye-bye.
Bye-bye.